Sure. Cancer remains a major health burden in Nigeria, hence drastic and novel measures are required to fight it. Nigeria has officially incorporated the HPV into its routine immunization system with the aim of reaching a record of 7.7 million girls in a single round of vaccination, the largest exercise of its kind in Africa. Girls between the ages of 9 and 14 will receive a single dose of HPV, which has demonstrated remarkable efficiency in preventing infection with types 16 and 18, known to be about 70% responsible for cervical cancer cases. Judith, enlighten us more in this. The federal government is trying to...
I watched the program during the week, and I was really impressed at the rate at which we are working with our global partners as a country to ensure that we give vaccination to as many people as possible. You need to go to Luth and see how cancer is already affecting kids.
Ravaging people.
There is a ward for kids afflicted by cancer. You burst into tears. And you know this thing, in terms of the pain that it inflicts, it's an ailment that you don't want to even wish your enemy. And I saw these children when I went for the documentary I did on Luth recently. I saw kids, 9 years, 11 years. Kids. Some less than 9. They are there. So, I don't know why these days more and more people are getting afflicted by cancer of different types.
Deadly diseases.
But one thing that is always suggested is that we try to detect early. Once your child or someone close to you is showing some signs, the best thing is to quickly take that person to the hospital where they can be tested, can be examined. Cancer can be defeated, especially at the early stage. We've seen people who are cancer survivors. Governor Akeredolu's wife, for example, is a cancer survivor. Today, she's doing her best fighting against the spread of cancer. She set up an NGO before she became First Lady. You know? So let's do our best to conduct a test so that they can attack it at that early stage instead of self-medication or not even bothering ourselves.
When people see vaccination, some people get to misinterpret the intention of governments and they'll just keep their kids off.
That is it. That's certain. And I think there's a correlation between cervical cancer and breast cancer. You know, it appears there are cases that move from cervical cancer to breast cancer. And so it's good. It's really commendable that government is that some people are taking this initiative, and government is also supporting the initiative for this vaccination. But we also need to tackle the extent of pollution in our society. Some of these things, we can identify some of the root causes, and they need to be dealt with. Issues like diet, we need to really look at that. What do people consume? The way some of these things are produced, some of these food items we buy, the way they are produced and all that, in unhygienic, through unhygienic methods. Government needs to really come down on some of these things. And if we need to really have a definite policy on the issue of plastics, the use of plastics. Some countries have actually come down hard on the use of plastics.
Okay, Emeka, we need to talk to an expert that's joining us for more discussion on this. Is the founder and CEO of Medicare Cancer Foundation. That's Dr. Zainab Shinkafi Bagudu. the immediate past First Lady of Kebbi State, is also a board member of the Union for International Cancer Control. Dr. Shinkafi Bagudu is also the chairperson of the First Ladies Against Cancer. Thank you for joining us, Mrs. Bagudu.
Good afternoon. Thank you for
ma'am.
having me. Good afternoon, everyone.
Good afternoon, yes.
It's a pleasure to listen to the group of you discussing cancer with such knowledge. And I thank you for always keeping the conversation up and amplifying it to Nigerians.
Okay, let me start by asking you, how are people reacting to these vaccines?
Well, I think we've had very reasonable, good reaction. A lot of girls who are the primary targets, aged 9 to 14, have been receiving it. The initial round is in 16 states, including the FCT and Kebbi State, and the feedback has been good. There are some states, surprisingly, where we have a higher level of education. They have higher routine immunization rates, where we're seeing lower than expected figures. I believe Lagos is one of them. This might be due to poor communication or awareness for now, but I'm sure when they get their act together, they will get on top of it, and the girls will come out and receive the vaccination. So the reception is good. It's a vaccine we've been fighting to bring into Nigeria for many years. It's an 18-year-old vaccine, and Nigeria is one of the last countries to receive it for various reasons. But it's here now, so we must not draw back on our efforts to ensure that we vaccinate all the girls that is possible. What you didn't mention is that with the HPV vaccine, it is possible to eliminate cervical cancer totally. It is the one cancer that can be eradicated and stopped, not just to zero level, lower levels, but to eradicate it. And the WHO has a program, an initiative, which is called the 90-70-90 initiative, whereby it is advised that 90% of girls are vaccinated, 70% of women of eligible age are screened at the appropriate time, and 90% of any detected lesions are treated early. If we employ these three measures, there are countries that have done it, including Rwanda right here in Africa. So if we employ these three measures, it is possible to eliminate cervical cancer.
Dr. Bagudu, Nigeria is said to have one of the highest mortality rates in the world from cancer. It is said that more than 72,000 Nigerians die in the hands of cancer each year. This is really frightening. What can we do better? And would you say that cancer is rising in our country currently, despite your best efforts and the efforts of others?
Well, I think first of all, we must put it in context and understand that Nigeria is a country of 200 million, over 200 million people. So whatever our numbers, whether we're talking about the number of bottles of water that we consume or the number of cases of cancer, it's going to be an alarming number to anybody that is watching. Having said that, it's actually an underrepresentation of the actual amounts. If you consider that most of the data that we capture and it's not the actual data, they're statistical projections. We do not have functional cancer registries in every country, every state in the country. They just take from a few as a sample and do the statistics to arrive at that figure. We're expecting some new figures in the next year, and it's expected that it's going to go up. But we shouldn't despair. I know that the awareness is higher. Studies have shown that the level of awareness is higher. The fact that you're talking about it so often means that we are more aware. And the more aware we are of it, the more we'll see the figures rise until we can start to flatten the curve. In the United States, they have a 95% survival, 5-year survival rate for breast cancer. So, but we are, like you rightly said, very dismal level. Over over 70% of the cases that we see end up in death. But that is because they come in late stages 3 and 4. But when you talk to the oncologists, they will let you know that for the first time in the last couple of years, they are now seeing cancer cases in stage 1 and 2, which means people are getting screened, and I'm sure that the coming out results from the researches that are ongoing will show us that we are seeing earlier cases.
Tobacco use is blamed for a lot of cancer deaths, especially amongst men, and as well as alcohol intake. What can we do to discourage the consumption of these harmful beverages and cigarettes?
Well, there are many risk factors, of which the virus we're talking about is one. It's a sexually transmitted factor. But when you look at cancers generally, the risk factor, lifestyle, lack of exercise, age, sex, alcohol, dietary habits, tobacco are risk factors. With particular to those two vices, there are efforts ongoing. There are taxations by the government. A new taxation was recently introduced on sugar-sweetened beverages. It hasn't actually, they haven't started withdrawing it yet, or should I say deducting the tax yet, but it's a plan that the government has. This will serve as a deterrent because the prices of those products will go up, or for instance, the beverage companies will use less sugar in their products so that they will be taxed less. So this is one very good initiative that has worked in a lot of high-income countries. And what they do is they earmark the funds to non-communicable diseases. The taxation, the revenue that accrues from that taxation will go to non-communicable diseases. And that's why we must call on the government to keep to its word and ensure that those funds, that tax actually goes to treatment of these cases of cancer, diabetes, hypertension, obesity that is associated with the use of sugar-sweetened beverages. The same thing for alcohol, but the alcohol tax in Nigeria is actually very low, as well as that of tobacco. What I think that we really need to focus on is awareness and education, particularly through efforts of people like you. In our rural areas, the big tobacco companies are still able to target underage children. We don't have the right laws and we don't have the right level of enforcement. A child of 12 can buy a packet of cigarettes without anybody asking for any ID. Whatever your age, nobody asks you for ID to buy anything in Nigeria anyway. So if we try to enforce those kind of regulations, but if you remember, there was a time when we could buy any medicine in the pharmacy, but now more and more we're reaching a level of, should I say, progress whereby the pharmacist will tell you that you cannot buy this without a prescription. So if we get to that level with awareness, with the right pressure, we have the laws already, but they're not being implemented as they should be. And then media, targeting young people, the use of e-cigarettes, making them into colorful, flavors and colors. These are all efforts that are ongoing and that the producers do, and we don't counter them with enough. In the UK recently, and I believe New Zealand has also passed that law. They passed a law whereby any child born after a certain year, for the UK I think it's next year coming, will never in his or her lifetime, be able to buy cigarettes. It's just the law, and that's it. So we need to also look at things that we can adapt in our own environment and make work for ourselves.
Yeah, Doctor, I would like you to enlighten us more about the relationship between cervical cancer and breast cancer. I'm using my mother's case as an example. She died in 2017, breast cancer, but I think it started from cervical cancer and later jumped to the breast. So this initiative is laudable. So I want you to really shed, light on the relationship so as to encourage as many girls as possible, and parents to also allow their daughters to go through this vaccination.
Yeah. Well, the relationship is none beyond that. Number one, she's a woman and she's of that age that you can develop these two cancers. Secondly, once a person has had cancer, he or she has a higher chance of having another type of cancer, even without metastasis. So it means that cancer is actually a disease that is caused by an interplay between the genetics and the immune system and some environmental factors. So you will see that some people will smoke all their lives, be exposed to the same toxins, and they will never develop cancer, whereas others do. So it means that there's something in their genes that makes them, or in the way their genomic makeup is made up, that makes them more susceptible and vulnerable to getting cancer. Cancer is just an abnormality of cell division. Instead of being controlled, the cells divide in an uncontrollable manner, and there is no control. So that makes it become either malignant or benign, and it's the malignant one that we worry about. So when a woman has had these two cancers, in all likelihood, if one were to look into her genes, her genomic makeup, then you will find that there's something there. And for such women, there are tests available which we advise their daughters to have, and I hope your sisters are listening if you have any. There are some women that are more susceptible to having this cancer. It's called the BRCA1 or 2 gene. If they carry that gene, then they are more likely to have ovarian cancer and some other cancers. And there's been a lot of research by very highly experienced people, including Nigerian Professor Fumilayo Olopade, who was once an advisor to President Obama. And these are the kind of people that are carrying out research all over the world about such things. The test is available in Nigeria. And if you do the test and it's shown that this woman is likely to have cervical cancer, is carrying that gene of having the BRCA gene, then some of them even have voluntary mastectomy. That is, they take off the breast, they take off the ovaries, they take out everything. Angelina Jolie, the very popular actress, is one such person. She's cleared every organ because she tested positive, all those reproductive organs I mentioned anyway, because she tested positive to that gene.
I'm very concerned about the level of awareness. You talked about areas like Lagos, places like Lagos, the awareness is so low. What are you doing to make sure we step up, the consciousness? Because a lot of people don't know about what we are talking here.
Yes, so this is where the work that civil society does is very important. The government has provided the vaccine. We're very happy. We celebrated last week the coming of the HPV vaccine to Nigeria. But the work has actually really just begun. Within that week, a lot of misinformation is flying around. It does this, it does that. People have said that it might cause infertility. I have 2 daughters, and they both received the vaccine, and my elder daughter just had a baby. The Minister of Health himself, Professor Pate, attested to the fact that his 4 daughters have had the vaccine, and we've not seen it harm them in any way. So it's about pushing the positive so that it can be louder than the negative. Yes, as a people, we're susceptible to superstitious beliefs and some rumor type thing, and with the advent of social media, the negative tends to fly faster. So we work with the civil society organizations. As you mentioned, I chair the First Ladies Against Cancer Initiative of Nigeria, which is actually a group of us, of former and current First Ladies, like myself, former, and the current ones. We have people like the current First Lady of Kwara, Katsina, and so on. There are about 18 of us that are involved in cancer control. And what we do is we work in our various states to make sure that the message through our NGOs, it's not through government, it's not funded by government. So we work through our NGOs to ensure that the messages are passed on. And thankfully, the authorities also work with us. So you will find agencies like NPHCDA that is in charge, that's the National Primary Healthcare Agency of Nigeria, that is charged with the responsibility of delivering vaccines, including this HPV vaccine, engages FLAC as a body. So we're like we help them take the message to the states. Whatever people say, whether we like it or not, First Ladies do have a loud platform that they can use. You mentioned my sister, Her Excellency Betty Akeredolu from Ondo State. She's also a member of FLAC, and she's doing a lot of work, both as a FLAC member and individually, in creating awareness and telling our people. We just had one of the largest, I think we call it actually the largest cancer walk in Nigeria yesterday in Abuja, and we employ the use of influencers, celebrities, so that people come out. We went to National Hospital to do a patient support, and the CMD walked in, I walked in, nobody knew us, but we went with Alex Okubo, one of the Nollywood stars, and the women, these are cancer patients, they all started jumping and shouting, and they were very happy. So whatever message those kind of people give to them, they take it. They're happy, they listen, they're very happy, they go home in a good mood. Oh, I saw this, I saw that. So those are the kind of measures that we employ and we try. Not a high number of our people are educated, not a high number have access to TV like we're doing now, but a very high proportion listen to the radio. So that's another good means that we always employ in our local dialects.
Doctor, I went to Luth to shoot a documentary recently, and it was a really sobering experience for me when I was shown a cancer ward for kids. It ruined my day completely because I didn't know that kids that young could actually be suffering from cancer. What really triggers cancer in kids as young as 9 years, 10 years, or even younger than that? What could be the problem? What's going on?
Yes, I heard you say that the commonest cancer in children are leukemias and lymphomas. And I mentioned, I also went on a visit to National Hospital on Friday, which is our own Luth in Abuja, and I was moved as well. I'm a pediatrician trained, but what I saw on that ward, honestly, I was really, really moved. I saw 9-month-old children, a baby with cancer of it's not even one of the common ones, of the bladder. There was another one with cancer of the ovaries, exactly, and she presented with a vaginal protrusion. So, number one, that is moving. Number two, I was highly impressed by the acumen of the medical doctors that made that diagnosis. The thing about cancer in children is that it is very difficult to diagnose. And it's no one's fault, but our fault as medical practitioners. It is highly curable. The leukemias and lymphomas that I mentioned, it has a 95% cure rate from 70% and above with the right medication, which we have and is available. But you have to give it to them. Unfortunately, when they present, children, they don't talk. They present with fever, lethargy, weight loss, and most of the time they're given repeated treatments for fever, malaria infection, and until it becomes catastrophic before people start to think of cancer. So late detection or no detection at all and lack of awareness amongst the healthcare professional is one of the major factors that makes the cure rate of cancer in children in low middle income countries like ours in the region of 20 to 25%. Your question was actually what causes it. Again, it's a factor of the immune system, and I don't want to say inherited, but in children it's not usually born out of environmental toxin or a virus. There are some that have been associated with some virus in like Epstein-Barr virus, EBV, in areas, malaria endemic areas. So you see a lot of Burkitt's lymphoma, which is when you see, sometimes you see them on the streets going around with huge lumps. And that is a cancer that is associated with us. But that's a virus. But mostly it is from the immune and genetic system, and they are born with it in a way. Like the baby of 9 months with a vaginal protrusion and turned out to be ovarian cancer. They would have thought that, oh, maybe it's some birth defect or so. But they did the right investigations and stuck to it. anywhere in the world, these are not easy things to diagnose at that age. So I want to use this opportunity to shout out to the doctors that they did that, and the whole team, the whole oncology team.
All right, I'd like to thank you, Dr. Zainab Shinkafi Bagudu, the founder and the CEO of Medicard Cancer Center Foundation. I want to thank you for the enlightenment. Jide, we have to start this campaign in our families. This is tough.
Yeah, even on social media.
I want to thank you. I'm sure we invite you more so that you enlighten us.
You'll be back
You'll be back
again.
like on one of our other programs. Thank you,
Thank you
Dr.
very
Thank you for having me. Thank you.
Bagudu.
Thank you, ma.
Jide?
Cancer. A 9-month-old baby.
So sad. So sad.
Ovarian cancer for
You
a
have to-
9-month-old baby. It's terrible.
I have to tell our people to go all out since the vaccination is available now. Just tell your girls.
Take
just
advantage of.
Take advantage. Let's go to the next service center and let's stop disinformation
Yes,
or any
yes.
kind of.
It's not helpful. It's not helpful to discourage people from taking life-saving vaccines.
Vaccination, I'm telling you. Well, Emeka Madunagu, I want to thank
you very much
for your contribution. And the master himself, Papa Jide Kolade Otitoju. Thank you. And that's a wrap for this edition of Journalist Hangout on Sunday. Join us tomorrow for the regular episode of Journalist Hangout by 5 p.m. You can watch the repeat broadcast tonight at 11:30 p.m. We're on YouTube, youtube.com/TVC News Nigeria. I'm Ayodele Uzubakun. See you tomorrow, and God bless Nigeria.